Good morning, everyone. I'm Rajni Yadav, Assistant Professor at Faculty of Pharmacy, Kalinga University. So this first pass effect example is isosorbate dinitrate, okay, propranolol. These are the agents which are undergoing the first pass effect. Now the routes of the drug delivery which eliminates the first pass effect is the sublingual, transdermal, buccal route, vaginal route, rectal route, intramuscular route, intravenous route, subcutaneous route, intranasal route. Okay, so now metabolism, it includes a lot of phase like hydrogenation, halogenation, hydrophobic reactions. So basically these all, they convert the drug into more absorbable form, and they convert the drug into the hydrophilic form, so that they can be getting eliminated outside the body in a very quicker way. Now the fourth process is the excretion phase. Now elimination is the terminology we use for studying both the metabolism and excretion. Now excretion basically is the removal of the drug from the body, complete removal of the drug from the body, basically through urine, feces, sweat, the exhaled air and the saliva. Now the patients which are having the renal diseases, or the patients which are having the liver diseases, so in those patients there is a need to lower down the dose and give them the drugs. Now for studying the elimination kinetics of the drug, bioavailability is a very important aspect. Now bioavailability is the extent to which the active ingredients are absorbed and transported to the site of action. Now bioavailability in general, you can also say that the available fraction of the drug in your systemic circulation. And the factors which can affect the bioavailability is the drug solubility, pharmaceutical formulations, pH, and the food present in the body. For studying of the elimination kinetics, there is a very important terminology that comes, that is the half-life. What is half-life? So half-life is when the half of the amount of the drug is getting removed from our body. That time period we call it as a half-life, or it is denoted by a T-half. It is also defined as the time in which a measure declines by 1/2. Now this T-half could be measured in three ways. Either we can measure the plasma half-life of the drug, or the biological effect half-life of the drug, or the biological half-life of the drug. Now these three are the important things. You can opt any of these three methods for giving the picture of elimination T-half. Now elimination T-half is obtained till the elimination of the drug is obtaining the steady state. So this was the ADME of the drug. Now pharmacodynamics. Pharmacodynamics is basically what the drug is exhibiting the therapeutic activity to the body. Now in this process, the drug can produce a variety of action. Either it can give the additive effect, either it can give the synergistic effect. What is additive effect? Additive effect is when 1 + 1 is giving you the result of 2. Like suppose in the treatment of bronchial asthma, the drugs ephedrine and aminophylline are given in combination because they are producing the additive effect. Simply the effects of aminophylline and the effect of ephedrine, they are combined and they are producing the combined effects in the body. It is also called as additive effect. There is one important the effect of the drug, that is synergistic effect. What is synergistic effect? Basically when we combine the two drugs, 1 + 1, but it is giving the result of 3. So 1 + 1 when it gives a result of 3. So like the example includes the cotrimoxazole, which includes the sulfamethoxazole and pyrimethamine. They are used for the treatment of the fungal infections. So this is an example of your synergistic effect. Now for studying of the pharmacodynamic action, it is very important that how the binding of drugs are being done by the help of the receptors. So basically we just now studied about the drug sources of drug, how the drugs are binding. So we studied about agonist, antagonist, partial agonist also. Now it's the time for the receptors. Receptors are basically the macromolecules which are present. 80 to 90% location of the receptors are on the surface of the cell membranes, or some are present inside the cell membranes. Basically the nucleus is the target area. Now receptors are also 4 types of receptors. One is the ligand-gated ion channels, second one is the G protein coupled receptor, third one is the enzyme linked receptor, and fourth one is the nuclear receptor. The ligand-gated ion channels, they are having the 5 pentameric units in them: alpha 1, alpha 2, beta, gamma, and delta. Alpha 1 and alpha 2 are having the drug binding sites, and once the drug is binded with those sites, the gate gets open, and once the opening of gate is happening, the movement of ions from the extracellular compartment to the intracellular compartment is followed, and the cell produces the therapeutic action. Second one is the G protein coupled receptor. So G protein coupled receptor basically are those receptors in which the binding of G protein, guanidine protein, is there, and its transducer mechanism includes the dissociation of 3 subunits. It contains 3 subunits: alpha, beta, and gamma. And when the agonist binds with this GPCR, in short it is called as GPCR, G protein coupled receptor. So when this agonist molecule binds to these GPCR linked receptors, so these subunits alpha, beta, and gamma, they gets dissociated. Alpha is dissociated alone, and beta and gamma, they jointly gets dissociated. Alpha subunit is responsible for producing the transducer mechanism. The transducer mechanism includes, first one is the cyclic AMP pathway, second one is the IP3-DHE pathway, and through these pathways the accumulation of calcium happens, and the drug produces the therapeutic action. Now when we third one is the tyrosine kinase or enzyme linked receptors. So in this, the tyrosine residue is present inside the receptors intracellular area, and basically the growth hormones, the insulin, they are binding through these enzyme linked receptors, and it includes 2 pathways. One is the JAK-STAT pathway, another one is the hormonal pathway. So the JAK-STAT pathway is the commonest pathway, that is the Janus kinase pathway is the common pathway for the transducer mechanism of this receptor, and the therapeutic action is produced in that way. Fourth one is the nuclear receptor. Nuclear receptor is present inside the nucleus, and the drug which needs to bind to the nucleus, example is glucocorticoid. The hormonals which are having high lipid solubility, they travel the cell membrane, they come inside the nucleus, they bind to the nuclear receptor, and they produce do the changes at the this genetic level, and they produce the therapeutic action in that way. Thank you.